All right, my name is Marcus Carlos, and the topic that I chose for my research paper was elective surgeries for inmates. So, what are elective surgeries? Elective surgeries are surgeries that are not deemed medically necessary, but which surgeries that should and could be deemed elective are often up to debate. It could be something from a mole removal, cosmetic surgery, laser tattoo removal, or it could be something as a sex change, weight loss surgery. There's a lot of examples, and they vary. A quote from Dr. Sands, who's a performing surgeon, had said, "Elective surgeries are vital to a patient's health and well-being." And as we see later on, from examples that I give, a lot of healthcare professionals do concur that elective surgeries could be necessary for a patient's well-being, or whether it be mental or physical. There could be health benefits that come along with certain elective surgeries, such as weight loss, reducing bad habits, and exercising more. Elective surgeries for prisoners. Prisoners could get a wide variety of elective surgeries in some states, but it does vary by state drastically. Such surgeries could include laser tattoo removal, cosmetic surgery, and sex changes. Prisoners' ability to get a sex change is the major hot topic among many people. It's been in the news a lot lately. In 2015, there's major court cases, which we'll talk about later, that sort of sparked this debate and this conversation about whether these surgeries should be paid for by the state. In California, it has been ruled that transgender prisoners have the right to a sex change because it is important to the person. Popular example of elective surgeries. So Sheila Quinn, who was an inmate born a man that was convicted in 1980 for first degree murder. Um, they had been taking uh, hormones, hormone changers and stuff like that since adolescence, and had always felt like they were transgender, and had actually sued California, uh, so that the state would cover the procedure costs and the medication costs that come along with transformation. They had argued that they had felt like they were a woman and wanted access to get a sex change because it was necessary. They sued California and had psychologists and other medical professionals to determine whether the surgery was necessary or not. The medical professionals actually did side with Sheila Quinn. Sheila won the case and was granted a sex change that would be paid for by the state. So they had also argued Eighth Amendment violations, and the Eighth Amendment is basically saying that it covers a lot of stuff, but in this case, it would be that prisoners have the right to Medicare, and they have the right to not be subject to cruel and unusual punishments. So for tattoo removal, this is another extremely popular um, elective surgery. So tattoo removal is another form of elective surgery that has been picked up. That has picked up a lot of attraction from the media. Getting a tattoo removed can help convicts go back into society. If an inmate has an offensive or gang-related tattoo, it could be dangerous for them to keep it, and it could prevent them from getting jobs. Prisoners argue that it is important for the state to offer tattoo removal. The state would sponsor these procedures, so it would come from the tax dollar. This is why it's very controversial. So in my paper, I discussed an example. It was a piece done by Vice, and they had followed prisoners, and they had followed an organization that removes tattoos for prisoners that are offensive or gang related. And they had found that a lot of the people that got these tattoos removed, were able to successfully rehabilitate into society and move away from the gang life. So there are a lot of examples that show that this could be good. Are some of these surgeries necessary? All right, so in the case of Sheila Quinn, two mental health experts and a mental clinician agreed with Quinn and had said that the surgery was medically necessary. The medical evaluators determined that it was necessary for her gender dysmorphia that she get the sex reassignment surgery. So Richard Carroll, who's a clinical psychologist, had said that, quote, sex reassignment surgery is medically necessary to prevent Miss Quinn from suffering significant illness or disability and to alleviate severe pain caused by her gender dysmorphia. In other cases, such as tattoo removal, it's not exactly necessary, but many people and ex-convicts argue that it is very important in order to rehabilitate and in some cases move away from gang affiliations. People argue that the Eighth Amendment lays responsibility on the government to provide adequate health care to prisoners. Again, the Eighth Amendment covers adequate health care, and it uh, prevents prisoners from being subject to cruel and unusual punishment. So, the cost of elective surgeries. So, while there are no exact figures about how much elective surgeries cost the state each year, we can look at specific cases and types of surgery. The reason we don't have exact statistics on elective surgery is that it varies wildly by state. So some states don't even allow any elective surgeries, while other states like California do allow some, such as transgender and sex reassignment surgeries. So spending wildly varies by state to state. So we will look at California's numbers as they have been more open to elective surgery for inmates. So for sex changes, the amount the state spends increases seemingly every year since 2015, when it was first allowed. Back Back then, the state spent about $150,000 annually, but now it is estimated the state spends around $500,000. Laser tattoo ranges from $120 to $360 on average, depending on the size of that tattoo. To get blemishes off, such as moles, the cost can range from $150 to $1,500. For sex changes, bottom surgeries can cost about $25,000, and top or breast surgeries can range from $7,800 to $10,000. These are all estimate costs for regular people who are not in prison. So these costs might fluctuate if prison started to allow elective surgeries. So what are pros of elective surgeries? So elective surgeries could incentivize prisoners to behave better if they want a procedure done on them. Some surgeries could help their mental status and make them feel better about themselves, like in the case of Sheila Quinn. Some procedures, such as tattoo removal, could help inmates remove offensive tattoos, in turn helping them come back into society. And it could be the first step in helping some get away from a criminal lifestyle. Prisons could also have newer surgeons or surgeons in residency perform elective surgeries on inmates, which would reduce the cost and give some surgeons more hours in the operating room. So cons. The government will have to pay for surgeries, and these surgeries, as we saw, could be extremely expensive, especially if you stack up those costs among, the hundreds or thousands or millions of prisoners that we have in the system. And obviously, when the government has to pay for it, that means the taxpayer has to pay for it. So it could lead to a lot of government spending. Some prisoners may take advantage of the system to get a lot of surgeries that they don't need or may not have even wanted to do. All right, and that's the end of my presentation. Thank you so much for listening. Goodbye.